like I was saying, so behavior change communication are the modification of human behavior and environmental factors related to that behavior which directly or indirectly promotes and protects the individual from harm. And we are saying that it's an interactive process to develop messages, approaches for specific groups using a variety of communication channels to develop and sustain positive behaviors. And I made an example of the groups and methods that you can use to organize your education to bring about that intervention or the change of behavior, and also to promote and sustain the individual, community, and social behavior. So if you look at purpose of behavior change communication, the first thing you want to do is what? Raise awareness. The first thing you have to do, and we look at the traditional health promotion issues to create awareness. That's the first thing you have to do. And then two, you must increase knowledge level. And that has to come with education. To increase the knowledge level of the people, let them understand the various condition diseases, the effect of those diseases, so that you can have much knowledge about the condition. And when they are aware, they are also likely to change. Must also increase intentions to practice a certain behavior. So the increased intentions to practice certain behavior is also paramount. And it must also create advocacy for a certain behavior to occur. And we'll look at them one after the other. So in behavior change communication, what kind of information are you supposed to give out to the people? And what are the consequences of unhealthy practices? You must all make these things known. So that what you are supposed to give to them, one, the consequences of what? Unhealthy practices. Let them understand that smoking, drinking will bring this kind of what? Behaviors, or will bring this kind of what? Disease or unhealthy condition into their life. There are appropriate skills to change behavior. What are the methods that they can adopt? Already we have established that behavior change is not easy. Behavior that somebody have enjoy smoking and drinking, and you are suddenly asking that person to change, it is not easy. It's not an easy thing. So what are the appropriate skills that you can give to the person? It should be a small, gradual process. Persuasion. To be able to, because at a go, you can't stop. Somebody who is drinking a pack of cigarettes a day, you cannot stop a day. So probably you may start maybe half a pack a day, continuously, you are counting 2 or 3, until the person get there. So the guys also get support from their community and family. It must also involve the community, especially when it comes to rehabilitation. When others have gone, maybe they have these mental health challenges. And community need to accept them back, to give them support. They can feel welcome to adopt a new behavior. Here like the case, if you don't have that support from family and community, it becomes difficult for them to adopt the whole behavior that you are putting before them to adopt. So you must also provide, as part of the information you are giving, make the community ready to understand that the condition people are going through, that's not the end of their life. If they are given the opportunity, they will be able to change, adopt good behavior, and they'll be better off. So you must also develop a guide to support, to get support from the community and family members. Yeah. So behavior change communication and behavior change. When you look at the two, we are saying that behavior change communication to bring what? Behavior change. And we have said that an interactive process, that is behavior change communication, several steps are also involved before behavior can be changed. There are several steps that we'll be looking at very soon before behavior actually can be changed. It's a process from learning to practice. People must learn and eventually practice the behavior that you want to see. So when you talk about behavior change communication, that is BCC, which eventually will lead to BC or behavior change, it's an interactive process. If you don't tell people, they don't know. You must interact with them. They must also tell you they are constrained, the reason why they engage in those behaviors. And it involves several steps before the behavior can actually happen. And the process begins by learning and eventually to practice. And finally, we are saying that for that behavior to occur, to say that you have a behavior change, that is a BC, modification in actions. The actions that are performed by individuals, you have seen modification in that. That means you have seen a change in those behaviors. So eventually you can say that behavior change has taken place. So it is important that you identify all of this. Any question before I continue? Any question? So we are saying that for you to see behavior change, there must be modification in action. So we can also use some of the methods that are used in behavior change communication. What are some of the methods that you can use? We say games. So which area? Let's talk about a health intervention that you want to undertake or you want to promote health. And you have to use games. Let's identify a health promotion activity where we think that we can use games to bring about change in behavior. Anybody? Is there any health promotion intervention that you would want to do and you think that you can bring games? And when we talk about games, you know, there are lots of games out there. We are not limiting ourselves to one, but there's so many games out there. Do you have any health promotion activity or health promotion that you want to bring about where you think that games will help you to bring that behavior change that you're expecting in the community? Do you have anybody who wants to help us?
Yeah, maybe if you want people to do regular exercise where they will cut down on their weight or reduce obesity in the community, you can engage them in games, maybe football and all that, and then that may help.
Good. That is excellent. So when you think that people are not engaging in regular exercise, and therefore there are a lot, we all know that one of the major causes of diabetes is what? Inactivity. When you become inactive, always sitting down, you can develop the disease. So all of these are important issues that we can look at. So when you think that people are not engaging in exercise, you bring about what? Football teams in your area. So every time you engage people to come and play, as they play, because it's a contact game, there's a stretch of muscles and all that. So there's some level of what? Change that you are bringing. Even though you are trying to maintain the health of people, they are also enjoying what they are doing because of what? The games that are involved. Others are winning, others are losing, and therefore there is some enthusiasm about the game. So that is one good example. How about lectures? What strategy or health condition that you think that you can use lectures to change behavior? Looking at those of us who have actually looked at the the education, health education, what we talk about 2 methods of education. What kind of topics did I mention in that lecture? That if you use lectures, you can bring that behavior change. What are the issues that you want to look at, and you think that bringing lectures in place will bring about that behavior that you want to change? Anybody?
Sanitation.
How? Why do you think lecture will do that in sanitation?
Maybe if you tell them, maybe you organize a lecture, you tell them about the consequences of not keeping the environment clean. I think they will kind of take it.
Well, any other? I want to hear people talking. Yes.
Yes, sir. If you want to educate them about malaria, you can educate them about not keeping stagnant water. That's a lecture. And keeping their environment clean. Those kind of lectures can also help them eradicate malaria from there.
That how do you call it? Role play will not help, or place in the community will not help. Role plays and all that. Well, that is your view. It's accepted. Any other? Any other?
So what about vaccination? Maybe engaging them or influencing them to take part in the vaccination program or something.
Come again.
Maybe if you want to influence the people in the community on maybe vaccination, or they're taking part in a vaccination program,
okay,
I think a lecture can also help.
Okay. All right. So, but last, you remember I talked about, especially when there are new conditions that people do not know anything about it. For example, when this thing came, COVID-19 came, it's new. A lot of people do not have any knowledge about it. So in that case, you must give out lectures so that at the end of the day, when there are questions they ask, you explain better. But when the condition has this, yes.
Please, my question, if COVID had not come, like what would we have used in replacement of those lectures? Like an example, apart from COVID, what else again?
We are saying that condition that has come and is new in the community, that a lot of people are not aware about the causes and then the solutions available to it, or preventive measures.
Oh, okay. Okay, sir.
Is that okay?
Yes.
So
sir.
easily you can use lectures because their knowledge level in that particular condition is limited. However, the malaria somebody talked about, I'm not disputing that, because there are people still in communities today think that malaria comes as a result of eating palm nut soup, as a result of standing under the sun. That is from research. That's what people say about malaria. But what we are saying is the lecture method, if you identify areas that people don't know much about, then you bring out lecture method. So they listen to whatever you are saying and take it from there. For example, when we started with this COVID thing, there were lectures, we watched conference papers being presented and all that. Everybody was keenly listening because it's something new. But now if you are organizing lectures on this, people have heard a lot of things. Now probably they want to see videos, they want to see demonstrations, they want to see role plays about all of those things. Then we can also talk about debates. Debates, we know, even in a common issue that are affecting us, we can use debate to bring about that, divide people into two, and then the prizes to be won. So people can bring their views on board. The role play, for example, malaria, they can also role play how mosquitoes move, where you sit outside in the night, and you are not in mosquito net, and therefore you are being bitten by mosquito. Eventually, you go through the process. You see the cycle of malaria. You can let them look at all of those. It can be what? Role play for them to see. And then there are other side, you have to use question and answers. Because you think that everybody has a knowledge in that particular area. through answering questions, you can explain better for them to understand. And there are some of them that you have to take study tour. Which one that you think that you can adopt study tour? Or you take people on excursion to bring about needed change that you want to see in your community? Any example? Which area that you want to bring about health promotion or health intervention? And you think that the best way of doing that is to take people on excursion to go and look at some of the things, or go on a visitation to look at some of the things so that they can actually appreciate what exactly you are talking about. Anybody? Well, you can do that if you want to talk about mental health.
Maybe when there is
water and sanitation.
Water and sanitation, right?
And say, hello.
Yeah. Yes,
About vaccine hesitancy. People who are hesitant toward the vaccine, you don't want to take the vaccine.
Mm-hmm.
So you can organize a lecture, or you can let them go into the hospital and see the number of cases of people who were having COVID-19 and they were not vaccinated.
Okay. So that is a good one. If people think that they don't want to take the vaccination hesitant, that has cropped all of us, put us into, yes.
Please, the point that he just made, I get a bit confused here.
Okay.
Who would go to the hospital to go and look at COVID-19 people that like that is being
because of the because of the infection? I understand. Because of the infection. However, it's also possible. You know, initially when COVID came, they say people are dying. Others will say that it is not true. So they want to be seeing dead bodies on TV so that they believe it. So you can take them far distance
Sir, they were just saying it with their mouth. Did you think like they don't know Kolebu to go there, or University of Ghana to go there and go and watch it? They were all afraid, but they were just saying it with their mouth.
They will be able to go as an individual. So when we are saying that 10 people has died, 20 people has died, people are saying that it was a lie. So they want to be seeing dead bodies. You know, that issue became a matter in this country.
Yes, sir.
Yes. So even though it's difficult, in fact, because it's the infectious nature, and nobody will be allowed to bring people to the hospital to come and watch, actually. But you can use any other disease condition that you think about.
Yes, I need a different example. Yes, I need a different example.
Yeah, you can even take the young people who are abusing drugs to see the condition of what? Most of the mentally challenged people. We are not saying that all the people who are in there because they engage in drug use. No, that is not the case I'm making. But we know that drug use also what? Contributes to mental health issues that we have in this country. So you can allow them, take them there to go and see their condition. That if they don't take them, they are likely to what? End there. Otherwise, those who are engaging in behavior that will eventually put them in prison. You can also take them to a prison tour to go and see the condition that people live in so that they can change what? Their behavior. You can take people to